When it comes to heart disease, where you live dictates when you die. When we look at what determines someone's health, statistically it's found that only 20% of your health is based on clinical care and your genetics. The remaining 80% is social determinants of health. It's access to adequate housing, it's financial stability, it's education, it's environmental, physical, and even mental well-being environments, transportation, it's support, actually having a community or a support system around you. And when you take those all into consideration, they make up, 80% of what attributes to whether you have a good quality life in terms of your health and even largely your lifespan. In the Twin Cities, life expectancy can differ by more than 13 years within 5 miles. The life expectancy in Mac, Groveland, St. Paul, and downtown Minneapolis is 83. That's the same as Japan, the best in the world. But if you go just a few miles to Rondo, St. Paul, or North Minneapolis, the life expectancy drops to 70. That's the same as North Korea.
So we've come to realize at the American Heart Association that context matters. Where you live and the conditions in which you live matter. Good doctors and great hospitals is absolutely necessary, but not sufficient. And then having the commitment as an organization to engage in that really more complicated place of figuring out what things we need to be all involved in to improve the heart health of all Americans.
We have just opened a dialysis center specifically for children, and that to me speaks volumes about the need for healthy foods, healthy diets, accessing those funds so that we might be able to provide that access to healthy foods to all our tribal members.
The Good Food Access Fund is designed to help communities create their own solutions, supporting entrepreneurs.
There's a market a couple of blocks away, but maybe they have an orange or a banana for 50 cents. It's mostly just convenience junk food. Most of my friends use walkers, wheelchairs, so it costs extra money to take Metro Mobility. The mobile market for some people is the only food we get.
I had one of my freezers go down. That's some of the cost that's would actually make a store like this fold. Access to be able to get newer equipment in here to make to try and cut some of the costs. Then I can bring back more things for the community.
People Center is a federally qualified health center, and so around 2015 we started looking at the trends of our hypertension rates, and we realized that there was a significant gap in terms of rates between our Caucasian population and our communities of color because they couldn't relate to some of the things that they were asked to do in managing their care. What we decided to do was find an alternative model of care that would fit the needs and the cultures of the communities we were serving. And slowly what we started to realize was that we were seeing improvements because people were engaged in their care because we had created a connection to something that they understood and knew.
I tried to ride my bike to school, and when I did, I didn't feel safe. The fact that you have to jump a guardrail and pick your bike up physically and climb through weeds and dirt in a marsh and throw it over the guardrail and get back on your bike. Ridiculous.
We know through heart disease statistics that heart disease prevalence continues to go up each year and each decade. So the more things that are in place, like safe routes to school where kids on a daily basis can walk or ride their bike to school, would make a huge impact.
If we're not getting enough money from our federal government to make this a possibility, we need to look at what we can do locally.
Communities of color are targeted so heavily by tobacco industries, and actually 95% of smokers are starting before they're 21. So one of the policies that the American Heart Association is working on right now and passing throughout the state is Tobacco 21 policies, which would raise the minimum sales age for tobacco from 18 to 21, because for the first time in 17 years, we know that high school students are actually smoking more than they have before, and that's after decades of a decrease in the incidence of smoking. In Minnesota alone, we're spending $3 billion in additional health costs just to treat these issues that could be prevented. If we are able to get this passed statewide, 30,000 youth would not pick up tobacco products and would not be lifelong smokers addicted to nicotine.
Minnesota is often credited with being one of the healthiest states, but we also have some of the worst health disparities. There are several organizations already doing great work, and the American Heart Association is part of it, but we need more help. Oftentimes the community has a solution. We need to create a common mission because no organization can do it alone. If we can change the living conditions, then we can change life itself. It's up to all of us.